Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh. Gary, well, welcome back to the broadcast.
Hey, thanks for having me back, Scott. Um, so today we'll be talking about how I know we mentioned in some of our previous podcasts about coronavirus, but I guess we'll get into more of how it's affected the health and the medical industry. So with that said,
Looking for a lot of looking for a lot of good information, folks, about something that doesn't seem to go away. And when you take the coronavirus and healthcare, boy, you talk about an unbelievable, outrageous animal. You definitely have one of those. So, without further delay, Gary, before we get into this, for all of our folks that are listening across our podcast network, speaking of Spreaker, Spotify, Apple, Google, and iHeartRadio, let everybody know how they can get a hold of you. And before you do that, though, I want to let everybody know that we have a new platform called StreamYard, which are doing these shows as well. And you can also subscribe to the South Florida Tribune YouTube channel as well. And of course, for those that are listening, feel free to follow us at Tribune South on Twitter. Okay, Gary, let everybody know how they can get a hold of you, and then we'll get right to the nitty gritty.
okay, best way to get a hold of me is my office phone is great. It's 954-532-2060. Because if I miss my call, it'll forward to my cell. So I never miss a call. So again, feel free to call me 954-532-2060. And then our website is www.medigapx.com. That's medigapx.com. You can click on our testimonials tab and see what my wonderful clients have said about me. And there's a lot of information there, articles and South Florida Tribune podcasts on there as well.
Gary, I should point out before we go any further, okay, let everybody know how long you've actually been involved in your profession.
I've been a career insurance agent for 32, going on 33 years. So yes, Scott, I definitely have a lot of knowledge. I bring a lot of knowledge and a lot of insight to the table, and I'm happy to share that with the public. I mean, I look at myself as a public servant. I'm out there to help the folks. Um, I'm straightforward. I'm unbiased. I'll give you the facts, and let my customers make the decisions, and they make intelligent decisions because I give them all the facts.
Right. So when you're actually talking to folks, whether they're clients or not, you want to make sure that you're accessible to everybody as well. Is that correct?
Absolutely, and I'm always accessible. In fact, as I said, I'm available 24/7. I don't typically get calls in the middle of the night, but sometimes I do get calls on a Saturday and Sunday quite often. And I'm happy to help, because if it's important enough for my client to need to call on a Saturday or Sunday, it's important enough for me to answer the phone and answer their question.
Very good. Okay. Well, Gary, what is the most profound way coronavirus has affected the health insurance industry? Deaths, higher rates, and more remote appointments.
Right. Well, and that's exactly right. Um, Coronavirus has affected both the health insurance industry as well as the medical industry. The first thing is it's affected the population in general. Over 925,000 people have died from this virus. Um, it's actually helped me as a Medicare agent to do more business, because most people don't really want to sit face to face anymore. They really would rather do business, remotely, due to the current pandemic. So for agents that have adapted to this new way of doing business, um, it's a huge advantage, because I essentially, almost all of my appointments are remote appointments, probably 95% of them. Um, so it's been bad. It's killed a lot of people. Coronavirus. It's been great for me. Again, I can see so many more and help so many more people, because the old way of doing business was I would drive to people's homes and their businesses, and now I can help a lot more people because I'm helping them from my office. If my customer has an email, a laptop computer, or a desktop with an email, I can enroll them in a Medicare plan or health insurance plan.
Now I got to tell folks, though, being a member of sports media, which I do a lot of, the remote stuff is a little difficult for me. Now, let me, even though I'm getting off subject for a moment, though, the remote stuff came in very big handy when I was covering the Super Bowl last week. So that was pretty neat being able to get those in. But when it comes to remote and not being able to do one-on-ones with players, that becomes a little bit of a problem. But like anything else, you always acclimate. But there's no question that with coronavirus, it has definitely changed the complexion of how things are done for sure. So, with that said, okay, let's go ahead and ask you, what is the most profound way coronavirus has affected the medical industry,
Okay,
clogging up
so we
hospital
went
ERs and ORs?
right. So Scott, so we went through. Thanks for asking me that question again, because I failed to mention one other thing: higher rates. Okay, so unfortunately, I think that insurance companies are going to have to charge higher rates in the future because of because of the pandemic and all the care that they've provided, and the fact that the industry is really being sort of pushed to the edge. So I'm glad you brought me back to the question, because um, I think rates inevitably are going to go higher. So I hope they don't, but unfortunately, as we see with auto rates and homeowners rates, insurance companies reserve the right to raise rates. Their expenses, as their expenses increase, they have to pass some of these higher rates on to the consumer. So thanks, Scott.
Oh, that's fine, Gary, because I think the one of the things that I always often refer to is when there's a shortage of staff and folks putting off surgery. Because nowadays there's always that hesitation, and I'm actually going to have to deal with this myself in a few weeks, where, I have a medical procedure due that I've waited. And to me, the most important thing that I've learned myself here is, you have to do what you feel is more peace of mind. So I can appreciate where you're coming from. So Gary, during a pandemic, is there one health insurance policy that is better than the other?
Um, there is there traditionally there are two. Well, there's really three types of plans: an indemnity type plan, which are those old fashioned plans that you and I grew up with, Scott, where you had, let's say, 80/20, you were covered at 80%, and then you had a deductible to meet. But nowadays, HMOs and PPOs are very, very common. Not so much the old fashioned indemnity plans, it's the HMOs and the PPOs. And during a pandemic, I would say, and that's a good question, because during a pandemic, when you see these hospitals filling up with patients, boy, it certainly is a lot more advantageous to have access to a national PPO, which basically means that you've got access to hospitals from here to California and back. So you've got access to a national network versus an HMO where you have only regional coverage. In other words, you're covered only in your regional area. So I would say, and also with a PPO, you've got out of network coverage as well. So that gives you a little bit more flexibility. Let's say you want to see a specialist, that specializes in, long COVID, right? As new of a condition as it is, it's a condition now. So maybe you need to go to a doctor that's not in your network. So with a PPO, you actually have out of network benefits. So again, with that said, I would say that the PPOs during a pandemic are probably going to be a better choice. Now they're also more expensive, so it has to be affordable too. Um, I hope that answers your question.
Well, I mean, obviously, it looks like you apparently did because I do not have a follow up with it. So if I
Okay.
decide not to get vaccinated, will I receive inferior care in the hospital?
Well, the problem is with this pandemic is when these variants come out, like the Omicron, it tends to clog up these hospitals and ERs and operating rooms. And there's a shortage of staff right now. I mean, I know nurses are highly sought after. They're being brought in from other states, from other countries. Um, so are you going to receive inferior care? Let me give my opinion on that. But let me just say that a lot of folks are, because of these shortages, a lot of folks are putting off surgeries that they would otherwise have gotten. Like a lot of people are putting off elective surgeries where they would have normally have already gotten their elective surgery done. They're putting it off for a future date because they don't, because there's obviously a staffing shortage in the hospitals, and the other thing is they don't want to go into a hospital where they could potentially be exposed to the coronavirus. Let's face it, hospitals are where a lot of these viruses and bacterias, uh, let me just say, they grow. A lot of these medical facilities harbor these bacteria and viruses. I mean, I think they do a wonderful job at keeping them, sanitized, but there's always that possibility that you can contract it while you're in the hospital. So a lot of these folks are literally putting off surgeries that they would have already had done by now. You asked me if okay. So you asked me about during a pandemic, or if you decide not to get vaccinated. That was your question. Will you get inferior care at the hospital? I think that was your question. I know I
Correct.
kind of went off track a little bit. Let me regroup and say that there's a process that the medical community uses called triage. So to answer your question, Scott, I think that, and I hate to say this, and I know this happens as much as we would hate to admit it, but I know this happens. If you're vaccinated, let's say you've got the same condition as someone else and you're both in the hospital. There are two patients with the same condition and they need the same care. One is vaccinated and one is unvaccinated. Because of the triage process, they'll probably take the vaccinated person first because they have a better chance of survival, a higher chance of survival. And that is a sad truth in the hospitals right now. Triage is creating very difficult situations for nurses and for doctors, literally having to decide who lives and who dies. And it's a horrible position for them to be in. So if you decide not to get vaccinated, I think you will receive inferior care, especially if there's somebody that's in the hospital that has a similar condition and they are vaccinated. I hope that's not the case, but I have a feeling it is.
So let's take vaccinated to a much higher level. Okay, we've talked about the two vaccines, and now you enter the booster into the equation. Okay, where do you feel that would actually go in terms of what we've talked about elaborating on? Just getting not only because I know lots of places that you go to work these days. Okay, and I'm talking going a different direction here for a moment. All right, so those individuals that are in regular jobs can understand. It's one thing to get vaccinated with, whatever vaccine you're looking at, but let's talk about the booster shots.
Well, listen, when you get to the, God forbid, should you be admitted to the hospital, the medical community, they know your vaccine record. It's all documented. They know if you've had one shot, they know if you've had both shots, and they know if you've had all three, which would include the booster. So again, I go back to my last statement. If if there are two people in the hospital and one patient's only had one vaccine, but let's say another patient's had all three, again, I think that patient may have a better chance of survival and may possibly be cared for before the person that only has one vaccine. And certainly if you're unvaccinated, I think you may be in line and you may have to wait for the vaccinated to get care first. Again, I'd like to think that's not the case. I would love to think that everybody's going to get the best care, but I just don't believe that that's how it works. With triage, again, I think the medical community, their goal is to save the person that has the highest chance of survival first, and that's going to be the vaccinated. If you're boosted, as Scott says, then you're even more protected. So absolutely, I think everybody should get both shots, and they should get the booster as well. Now they're even talking about a second booster now, so I believe the FDA is actually considering approving a second booster. So listen, I mean, take it. I'll be in line. I'll be in line to get that second booster, and I'll have gotten four jabs. And let me just say this, if you think at this point that even the Omicron virus is minor, I mean, God forbid, but the Queen of England just came down with the Omicron virus, and she has mild cold symptoms. But the fact is, she's fully vaccinated. If you're unvaccinated, even this lesser Omicron virus can kill you. Okay, so keep that in mind. So there's a lot of research. That's been done on these vaccines. Let's just, again, I always say, let's just follow the science. The science, says that we need to be inoculated. Let's just follow the science. And as Scott said, the booster is definitely along the guidance that is offered by the CDC, for sure.
So then let's take this to an even bigger level than we're already at. Okay, we're talking about inferior care. The more vaccinated you are, the less risk it is for the medical professionals that are helping you out as well. How much do you think that might factor into the thinking of a lot of individuals? Because we all know that each and every one of these contagious, the last thing a doctor or nurse wants to be subjected to is somebody unvaccinated, then they find themselves sick as well.
Absolutely, Scott. You make a great point. I mean, these medical professionals that are out there on the front line treating people, yeah. I mean, if you were a doctor, would you rather treat someone that's fully vaccinated or somebody that just never believed in the vaccines? Yeah, I mean, your point well taken, Scott. So as Scott's saying, get out there, get the jab. I mean, I think most Americans have already, but I think there's still a segment of people that just don't believe in science. They don't know what's in the vaccine. They're not sure. But my feeling, and as I think other people share my general feeling, and that is, I would much rather take the risk of taking the vaccines, all of them, including the boosters, and taking whatever potential risk lies ahead of me, from maybe a side effect from the vaccine, because I know damn sure that if I get the coronavirus, it's going to be a much more difficult road to hoe. I may not make it at all if I'm not vaccinated.
Well, to me, a vaccine means nothing more than just peace of mind that you're not in serious medical problems. I know my Aunt Judy, God rest her soul, passed away because of COVID-19. And I have some good friends and some other family members that have been subjected to this thing as well. My attitude is peace of mind. Don't take it lightly. We have one more question to run by you, Gary. Is
Sure.
tell Medine here to stay, or is it just a way for doctors to see more patients?
You say telemedicine? Telemedicine, yeah, I got it. Telemedicine, I think, is here to stay. It became very popular and almost essential during the initial coronavirus pandemic. But but I definitely think it's here to stay. Um, I think it's a I think it's obviously it's a very new technology, but I think the longer the technology is here, and that again, that's telemedicine, whether it's through your smartphone or your computer, I think telemedicine is here to stay because as technology improves, doctors will be able to see your blood pressure through that telemedicine appointment. They'll be able to check your heart rate and your heart function through that. They'll be able to check your blood oxygen level. There are a lot of additional um, things that doctors will be able to monitor through these telemedicine visits as the technology improves. So absolutely, not only is it here to stay, I think more devices will be utilized in the future so doctors can get more accurate readings right there while they're on that telemedicine visit with you, and then they can actually monitor your stats right there while you're on the phone with them. In fact, I think, and this is just a prediction, maybe speculation, if you will, that I think that in the future, I think every initial appointment with your doctor will be a telemedicine appointment. And then at that point, they'll decide whether you actually need to be seen physically by a doctor. And I think that's coming. I really do, Scott.
Oh, kid. Well, we all talk about new things in technology. We talk about the electric car. Now we're talking about telemedicine and all that. And who knows what else is going to become what it is. So, folks, I hope you've enjoyed this edition of the South Florida Tribune podcast. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh. Gary Kornbluh was a medical Medicare health insurance agent. And, the thing that I really enjoy about yours is a very, very informative broadcast. And I think that for a lot of individuals that are tuning in to it, whether it's through Spreaker, Spotify, Apple, Google, iHeartRadio, or watching via StreamYard and our YouTube channel, which we do encourage you to subscribe to our YouTube channel. There's no charge to do so. And I should point out that our broadcast can be found on www.southfloridatribune.com. If you have any questions for Gary Kornbluh, feel free to write us at southfloridatribune@gmail.com. So, and we'll forward those on to Gary, and then we'll make sure that we have answers as well. So, Gary, as I said, then I want to also point out that these broadcasts are being shared with Twitter. I have a Twitter account at Tribune South. So, Gary, why don't you let everybody know how they can get a hold of you again, please?
Absolutely. Feel free to call me. My phone is on 24/7. My office number is 954-532-2060. And you can even call me or text me on my cell. It's always on. I'm always available for my clients or prospects. And that number is 561-305-5949. If you want to log on to my website, you can always do that and look at my reviews before you decide to call me. And there's a lot of good information on my website. You can click on my testimonials tab, and that's www.medigapx.com, MEDIGAPX.com.
And if you want to learn a little bit more about Gary Kornbluh, what he does, don't hesitate to go ahead and Google his name. It's spelled GaryKornbluh. So you'll find that a lot of things that Gary's done, not only with our network, but what he's done, he's accumulated an awful lot of credibility because, he makes himself visible. And I think that's really very important for us in this day and age, to realize that there are a lot of people that are fly-by-nights and you don't know who to trust, but Gary's body of work extends over close to 33 years, and I think that speaks volume in itself. So, with that said, folks, once again, we appreciate you joining us tonight, and we look forward to the next time that Gary's on the broadcast. But meanwhile, I encourage all you folks out there to play this broadcast back as often as you want. Take some notes because knowledge is power, and I hope we've given you the opportunity to have plenty of that tonight and on each and every show that Gary appears on here as well. So, any closing thoughts, Gary?
No. I'm I'll just say, 32 plus years in the business. I've I can help a lot of folks. No question is too difficult. No situation is too complex. Just call me and ask me. And once again, 954-532-2060.
So
Happy to
there,
help.
so there you have it. Okay, so on behalf of Gary Kornbluh, my name is Scott Morganroth. Thank you for joining us, and we'll catch you the next time. Meanwhile, folks, be safe out there, and we appreciate you tuning in and listening. Good night, everybody.
Good night, everyone, and thank you.